Well, good afternoon, everyone, and thank you very much for joining us for this update. Today I have with me Dr. Heather Morrison, of course, Chief Public Health Officer, and Norbert Carpenter, the Director of Public Schools Branch. I just wanted to give a quick overview that since Saturday we have tested over 3,500 Islanders. More specifically, we've tested over 1,700 individuals aged 19 and under over the past 5 days. And I just want to take a moment to thank each and every Islander who listened to the advice of Dr. Morrison and went to get tested so that the Public Health Office could quickly wrap their arms around this recent cluster of cases. Not unexpectedly, there's some new cases to announce today, but Dr. Morrison will provide those details momentarily. I also wanted to say that on Sunday, to allow public health the time to complete contact tracing and to test as many people as possible, there was an order issued to close all Charlottetown area schools for 3 days to remove any potential of further exposure or transmission of COVID-19 as we tested. Based on the advice of the Chief Public Health Office, we will be returning to in-person learning to all Charlottetown schools with the exception of West Royalty Elementary tomorrow. West Royalty Elementary will resume in-person classes on Monday, September the 20th. As previously announced, all schools across the province will be under enhanced restrictions in the back-to-school plan with some modifications. And one of those modifications will include the masking at all times for grades 4 through 12. In addition, based on the advice of Dr. Morrison, the government of P.E.I. Has been and will continue to be working to implement a vaccinate or test policy for some settings or workplaces where there is regular interaction with vulnerable Islanders, in particularly those who are unable to get vaccinated. This could and will include schools, early learning centers, correctional centers, group homes, day programs, and healthcare settings. It will be up to each department to work with these sectors or workplaces to operationalize this policy direction. The CPHO will provide policy guidance, set the reporting guidelines for these sectors, and provide them with self-administered test kits in the coming days. And we expect that these policies will be announced in the coming weeks, will come into full implementation once we operationalize by department. We hope that these will be short-term measures, and it will encourage people to get vaccinated to help us get through this as a province and a country. We still remain in a very fortunate position here in Prince Edward Island. The steps we have taken will allow P.E.I. to stay open, to have our kids in school, to have our health services uninterrupted, to have family visiting loved ones in long-term care homes or community care centers, to have gatherings with friends. And our ultimate goal is to stay open while keeping Islanders safe and to have as normal a life as we can have during this fourth wave of COVID in our country. As the cases rise across the country and in Atlantic Canada, we need to implement some new measures for the foreseeable future. Among those will be the reinstating of mandatory masks for indoor public places starting on September 17th at 8 a.m. We will also be testing all children 8 to 12 years of age who are entering the provinces through our points of entry. In addition to the point of entry testing for this age group, any child under the age of 12 will be required to be tested after being out of province before returning to school. They will also require follow-up testing on day 4 and day 8. We continue to work diligently on implementing a vaccine passport system, which we plan to have operational by early October. An interdepartmental working group from across all departments of government is working daily to expedite this implementation, similar to what our provincial neighbours are doing in Nova Scotia and so what you might have seen in other provinces. All of these measures, as I say, are designed to keep Prince Edward Island open while keeping our province safe. And just before I turn it over to Dr. Morrison for a more fulsome COVID update and more in-depth about some of the measures that I've outlined, I just want to say again what bears repeating, even though we've said it almost daily on these briefings. If you have symptoms, no matter how minor, we want you to go and get tested. We don't want you to go to school or work if you have symptoms. That is regardless of your vaccination status. As soon as you experience any symptoms, it's important to go get tested as soon as possible, and in doing so, you help keep yourself safe and your community and your province safe. So with that, I'll turn it over to you, Dr. Morrison, for your briefing.
Thank you, Premier, and I think you outlined much of what I'm going to say here. Good afternoon. It's good to be here, and thank you for being here. There are 5 new cases to announce. 4 of these individuals are close contacts of previously announced cases associated with the outbreak at West Royalty School, meaning that they have been in self-isolation for the last number of days. And 1 case is related to travel outside of Atlantic Canada. 4 individuals associated with the outbreak tested negative initially and subsequently tested positive, highlighting the importance of repeat testing of close contacts. 3 of these cases are between the ages of 10 and 19, 1 is in their 20s, and 1 is in their 40s. Since Saturday, we've reported 20 cases of COVID-19, 12 cases associated with the West Royalty School outbreak, 2 associated with Charlottetown Rural, 2 associated with Stratford Elementary School, linked to a case outside the school, 3 cases associated with travel outside Atlantic Canada, and 1 a close contact of a previously announced case. We currently have over 400 close contacts. Close contacts are legally required to self-isolate depending on their vaccine status. We've had a total of 260 cases since the pandemic began. As I think I almost ended the last press briefing saying that we maybe want to be done with COVID-19, but COVID-19 is not done with us. Our epidemiologist looked back to see what our COVID-19 situation was at this time last year. And on September 14th, 2020, there were 7,582 active cases in the country and 8 in P.E.I. In comparison, yesterday in Canada, there were 42,500 active cases and 27 in P.E.I. And I think these numbers speak for themselves. We've had questions about casual contacts and close contacts and isolation requirements. Since the beginning of the pandemic, we have identified close and casual contacts based on the information gathered by public health during the investigation. Close contacts are individuals who have prolonged and close contact with a positive case while they are considered infectious. A casual contact is someone who was at the same location and at the same time as a positive case, but did not have the same prolonged direct contact with the case. For example, students and teachers in the classroom with a positive case are considered close contacts. Students who sit in the same seat on the bus with a positive case are considered close contacts. However, all children on the bus other children on the bus may be considered casual contacts. Close contacts will all receive a call from public health and they will be advised based on their testing and isolation requirements what they should do, and it will depend on their vaccine status. Casual contacts are also contacted by public health. However, they are advised to test on day 4 to 6 after the exposure and monitor for symptoms. It's important that all close and casual contacts monitor themselves closely for symptoms, and if they begin to feel unwell, they should isolate if they aren't already in isolation and test immediately. Since Saturday, September 11th, a total of 3,500 PCR tests have been conducted in P.E.I, and those are in addition to our point of entry tests. And almost 1,900 of these tests were completed on youth under the age of 19 years of age. Despite our best efforts, we have not been able to link any of these cases to travel outside the province. As such, we are dealing with community transmission of COVID-19 in the Greater Charlottetown area. We are focused on managing this situation and will continue to conduct contact tracing, testing, and isolation of cases and close contacts. And I mentioned this before, but I expect there will be more cases in the coming days, especially for those who may be identified as close contacts and who are in isolation. If close contacts who are isolating test positive on repeat testing, there's no risk of a transmission to the general public because they've already been isolating. On Sunday, as the Premier mentioned, we made the difficult decision to close the Colonel Gray and Charlottetown Rural Family of Schools for 3 days. In addition, West Royalty Elementary School was closed for 5 days. These short-term closures were necessary to allow time to investigate the cases, arrange for contact tracing and others to be tested, and to determine the extent and scope of transmission in our schools and community. And we needed time for more people to be tested. During the past 4 days, we have been able to identify close contacts and arrange for them to be tested and retested and isolate. We've identified casual contacts and advised them to be tested and monitor for symptoms. We've encouraged people with any symptoms of COVID-19 to be tested. We have limited transmission of COVID-19 to other settings, including schools. We now have people in isolation, as we pointed out earlier, testing positive after initially testing negative. And I know schools with confirmed cases of COVID-19 have had time to undergo a deep cleaning. And I believe we've gained more information about the extent of transmission within the schools and in the community. Based on the findings over the last 4 days and what we have learned, I will rescind the order to keep schools closed, with the exception of West Royalty Elementary School. All schools in the Colonel Gray and Charlottetown Rural Family of Schools will reopen for in-class learning tomorrow, Thursday, September 16th. These schools will once again be available for use by community groups. West Royalty Elementary School will reopen for in-class learning on Monday, September 20th. Individuals and classes that have been identified as close contacts will not be returning to school until their self-isolation is complete. In the case of Stratford Elementary School, despite the widespread testing over the past few days, there is no evidence of in-school transmission of COVID-19. The 2 cases at Stratford Elementary are close contacts of other cases, and as such, they are not considered an outbreak at this school. Based on the contact tracing and test results to date, I feel that it is good for and safe for students and staff at Colonel Gray and Charlottetown Rural Family of Schools to return to school tomorrow, with the exception of West Royalty. Students and individuals who have been identified as close contacts of positive cases will be able to return to school at the end of their required period of self-isolation. As the Premier mentioned, there'll be additional measures implemented in schools to make schools safer, as we all face an elevated risk scenario across the province. Schools across P.E.I. will remain in the elevated risk public health measures as identified in our guidance to the education system for the back-to-school plan. And it will require cohorting in in kindergarten to grade 6, enhanced cleaning and disinfection, and physical distancing to the extent possible. In addition, students and teachers in grade 4 to 12 will be required to wear masks at all times in school and on buses, except when eating and drinking or when engaged in physical activity. Teachers can remove masks when teaching, provided they are fully vaccinated plus 14 days and can maintain physical distancing. And in terms of why masking for children in grades 4 and up, the evidence suggests that children 10 and over, or in that age group 10 to 19, transmit the virus in a manner similar to adults. As well, it is challenging and sometimes not quite as practical for teachers and staff to manage adherence to full-time mask wearing in children in grades kindergarten to 3. The 3-day suspension on recreational and extracurricular activities for youth under the age of 19 in the Charlottetown area ends at midnight tonight. But while extracurricular and recreational activities can resume, organizers should continue to have a process to screen participants, encourage mask wearing, promote physical distancing, and minimal contact. Participants should not attend school or extracurricular or social activities if they are not feeling well. For youth playing sports, it is best if they get dressed for their games or practices at home to limit time spent in dressing rooms and common areas. Interprovincial travel related to sports and recreational activities for individuals who are not fully vaccinated is discouraged. Groups that include unvaccinated or partially vaccinated individuals who decide to travel off island should ensure that youth have a negative test on entry before they go back to school and on day 4, regardless of symptoms. Parents and guardians should continue to be cautious and limit social gatherings for children, including sleepovers, and gatherings should be kept small and outdoor activities are preferred. The rise in COVID-19 cases in P.E.I. and other provinces, including Atlantic Canada, is concerning. The 4th wave of COVID-19 has arrived in Atlantic Canada, and it is already affecting healthcare services in some communities in the region. We have also seen a rise in cases in P.E.I. in the last week, and we have not been able to identify a link to travel for many of the cases. We have heard from other jurisdictions that the Delta variant spreads like wildfire, and the sharp rise in our cases is a reminder of just how transmissible this variant is. We need to work together and do everything we can personally to limit the spread of this virus in our province. In order to further protect islanders by limiting importation and transmission of COVID-19, which has really been some basic goals right from the beginning of the pandemic, and also provide additional support for our children to remain in school, we'll take the additional following steps. We will, and we've announced this before, maintain our border screening, testing and isolation process at our points of entry for those coming to P.E.I. until at least mid-October, and those traveling back and forth from P.E.I. We will expand our testing, including at points of entry, for school-aged children under the age of 12 who are not eligible to be vaccinated. We are recommending that school-aged children under the age of 12 who have been out of the province for more than 48 hours have a negative test before they return to school, and again on days 4 and 8. We are recommending that school-aged children under 12 years of age who have been out of the province for less than 48 hours to be tested on day 4 and 8. Effective at 8 a.m. on September 17th, for the foreseeable future, the following measures will be in place. Personal gathering limits will be limited to 20 people, and that's a decrease from 50. And non-medical masks will be mandatory for all islanders in indoor public places. And this is similar to what we've had before. Masks will be mandatory in locations including but not limited to stores and retail businesses, personal services and salons, restaurants except when eating or drinking, arts, sports, and recreational facilities, except during exercise or when masks cannot be worn, places of worship, government buildings where public services are provided, taxis and public transit, workplaces that are open to the public. Exemptions to the mandatory masks include, but are not limited to, children under the age of 2, children under 5 who will not wear a mask, valid medical reasons such as active breathing problems, but most people with underlying medical conditions can wear a mask safely. Anyone who cannot remove a mask without assistance. And lastly, I think it's worth noting that P.E.I. residents should not travel unless they're fully vaccinated, and those who are unvaccinated or partially vaccinated individuals should perhaps reconsider the excursions that you may be wanting to take at this time, given what is happening in the country. So I'd like to thank you all for, in terms of, especially the youth and parents, for responding to the call to be tested. You've done that before, and I know you'll continue to respond to that call. Thank you to the professional health P.E.I. staff, including those at testing clinics across the province, especially at 64 Park Street, as well as the provincial lab for their dedication and long hours over the last 5 days. Thank you for your continued support, allowing so many people to be tested and get the results. Testing has been key in our ability to manage this pandemic and is especially important when we are dealing with outbreaks and this sharp uptick in cases we are experiencing. We want all businesses to be open, we want to be able to continue our activities, and we want our children to be in school. We all want to live as normally as possible as we enter this 4th wave of the pandemic. We want to identify cases early, conduct contact tracing, and limit importation and spread. Adjusting these public health measures allow us to live with COVID-19. We will continue to have to adjust measures and we'll do so as necessary, and we'll always aim to strike a balance of safety and minimizing disruption in our province. We will be making decisions for the greater good and health and safety of all islanders as we continue to learn to live with COVID-19. Adjusting our public health measures like we are announcing today is living with COVID. And we will get through this together as we have and as we will. And let us continue to be patient and kind. Thank you.
Well, thank you very much, Dr. Morrison. And just before I open up the floor to questions from our friends in the media, a couple who are here in the studio with us and some online, I would just remind all that Norbert Carpenter is here, the director of the public school branch as well. And he can enlighten you and answer some of your questions about the online learning component that has been implemented for schools, et cetera, or any other operational questions from an educational perspective. So with that, we will turn it over to, we'll go live, maybe Laura Meader, CBC.
Hi, I guess I'll direct a question first to Dr. Morrison. I was just looking for a little more clarification in terms of children who are traveling and school age, under 12, and then you're required, in light of those negative tests that turn positive, do you want children who are traveling out of province to attend school when they return, or wait for that 4-day test result kind of thing? I'm just curious about that.
No, so for children under age 12 who, it's the group that aren't vaccinated, we're saying if, I don't know, maybe they are going, we know there's some teams, for instance, traveling over the next few days out of province. And when they come back, I'd want them to have a negative test before they go back to school. And then, but they can attend school, and then they will also get repeat tests on day 4 and day 8. Obviously before that, if they have any sign of symptoms. It's just one additional measure we can do, and trying to keep our schools safe and our community safe.
And I know, like you said, you haven't been able to pinpoint the source. Is it fair to say that spread happened at the school?
For the West Royalty School, there was, that's really why it was called an outbreak. There was transmission, and that's part of the definition. There was transmission within the school and a school setting. So that would be on the bus or within the classroom, for instance.
Okay. And in terms of with the people who were isolating or identified as close contacts, initially they tested negative, then that turned positive. I'm wondering, did they have symptoms?
Actually, it's interesting that the majority of the cases are symptomatic. They have mild symptoms for the most part, but it seems to be certainly that they're having mild symptoms, and sometimes they test positive, or some of the cases we've had seem to not have symptoms necessarily when they went to get tested, but even by the time we called them, they're like, yeah, we're starting not to feel well.
So that's a yes then, by the day 4, the follow-up test. All right. And then I guess, you know, any parent that is watching today or hearing what you're saying, I think it would be fair to say they'd be concerned or nervous. This is an example that, you know, we know COVID is here. And so what do you say to families out there who might be worried as their children are going to be returning to school, probably tomorrow for most people?
Well, maybe I'll start and I'll let the Premier or Norwood add to it as well. But I mean, I think in general, what's happened here in the last few days is a stark reminder that COVID and the full 4th wave and the Delta variant can impact us here in this province, and remind us about the measures that we even have had in place, how important they are to follow. In terms of parents being concerned, I also have two of my 4 children are in that group where they are unable to be vaccinated. So I can understand some of those concerns. But I also know that the measures that are already in place and the ones that we're adding are all important, and help me feel better as a parent, but I think are good for all our students. And we've talked about the importance of family members who can be vaccinated, making sure they're vaccinated, and we have increasing numbers of people in this province who are eligible to be vaccinated and who are, so I think that's really good. I think it's really important that, you know, I'm like anybody else, sometimes you might assume in the past that a little runny nose, not a big deal. Maybe we could send the child to school, but I'm hoping I won't be doing that again, and I hope other parents aren't doing that, because we really don't want anyone to get sick and spread the virus. And COVID symptoms are very similar to what we have in other respiratory viruses at this time of year, and it's what we've also done all the way along, trying to do masking, hand hygiene, the enhanced cleaning we've talked about, and also the limitation and some of our social interactions too, important. But we know how important in-school learning is. And we've said it here before, and I know Norbert would speak to it as well, the importance of in-school learning, and also for the activities that all of our children participate in, really important. So how do you balance that with COVID as well?
You expect to see more school cases in the future?
I mean, we knew going into this fall, you know, even a month ago, I said we would expect cases in school, and I hope we limit it. I hope some of what we're doing and continue to do will limit the number of cases. But I think it takes all of us in the community to be part of that. We know that COVID in schools doesn't get there unless there's usually someone else who has had COVID. So.
I probably exploited my 2-question limit, so I'll...
Okay.
We appreciate you being here.
Yeah, nice to see you, Laura.
Dave Stored from The Guardian.
Thank you. Thank you all. I guess my question, first question would be directed to Norbert in terms of students who are self-isolating at home who have been affected by this. What is being done to allow them to learn remotely? And what can you tell us about you know, how the system is encouraging that and allowing it?
Great. Thanks for the question, Dave. Yeah, a few points, and then I'll try to give you a little bit of context. So for a K-6 school, and then a couple examples we have right now on the go, it's a little simpler, if you will, because the teacher, if she's deemed a close or he's deemed a close contact with the students, would be able to offer remote learning to the whole class, because we have that situation at West Royalty. An entire class are in self-isolation, so that works quite well. I mean, obviously it's not the gold standard, it's not in-person learning, so we're working with the Department of Education about that. So there's that. Now, if you go to grade 7 to 12, it's a little more complicated because of the nature of how classes are ran. You could have a teacher going to teach biology, for example, and math in the next block. So we have in place now for the school, Charlottetown Rural, for example, with a large number of students that are in self-isolation. We have some programming set up for them, and then we'll be hiring some substitute teachers sort of to be that conduit between the homeroom teacher and the students that are at home. So using online platforms to keep them abreast of what's going on in the classroom.
Do you feel, I mean, obviously, I would assume we feel this is contained in the Colonel Grange Charlton area family of schools. West Royalty is opening on Monday. A message for parents in terms of, there's a lot of angst out there in the community. What, you know, reassuring parents from your perspective on just how you feel going forward.
Yeah, so it certainly has been, you know, a worrisome period for all of us, I think, and you know, I take great comfort in the advice that we've heard today from Dr. Morrison, the extra measures that are being put in place, and the things our staff are doing as well. So, and I think it's playing out before our eyes in the 2 examples or 3 examples we have. You know, I think people should be comfortable in the fact that West Royalty is not opening tomorrow because it's not deemed ready to open yet, and the other schools are. So I think we have to respect the science that's happened and the contact tracing that's been done. And I really think the biggest message is we need to do our part. We need to enforce the masking where we can. We need to do all the other measures that we've been doing all along. So I realize it may remain worrisome, but I do think the evidence points us in the direction that school is safe. And in-class learning, I think credible authorities like, you know, the Canadian Pediatric Society and OECD have told us, you know, the dangers of not having in-class learning over time are quite stark. So I think we're doing the right thing.
I could just add, if I could, I think since the beginning of the pandemic, we've been living in what I think we could safely call a heightened level of concern right across the board. And I don't know if that has dissipated over the summer or because we've done better in this jurisdiction than others. But I think maybe we got a little bit more comfortable with where we were in this province as compared to what was going on in the rest of the country, which is normal. I mean, I think all of us in this room and beyond would be somewhat guilty of that, or at least guilty of wanting to be that. And I think, you know, the news of the weekend, I think, sort of snaps us back into that heightened level of concern where we were. And, you know, we have been through this before to a certain degree. We had some incidents last year in a school, and there was some angst amongst parents and students and staff to go back. And that is a normal feeling for everybody to have. And you know, I fully expect there will be some parents that might want to take an extra day, and we understand that. But, you know, from a health perspective, you know, the direction has been given that there's not an immediate health concern as there was when we made the decision, and we go back to where we were from the very beginning of this, and that is learning to live with COVID and have some kind of normal life. So I think I think we all should be concerned because we're in the middle of a pandemic with a 4th wave and a Delta variant that is shown to be very aggressive and you know, stubbornly persistent. So we should be in a heightened level of concern.
Can you give me some more idea, but the vaccine passport you've mentioned again, and any further down in the road in terms of details on that?
Well, not probably where we're ready to go into particulars on it, but essentially what you've seen in other jurisdictions and what you'll see here is a proof of vaccine to give a comfort level of being able to have as normal a life as possible within our community, and it really emphasizing the need to be vaccinated. The vaccines work. What we're seeing across the country is a growing level of infection of people who aren't vaccinated, and that's, you know, I think the numbers are there for everybody to see. Look, we've had the business community reach out to us. We've had islanders reach out to us and so far beyond to say, what can we possibly be doing to have as normal of life as possible here in P.E.I.? Can we, you know, go to a vaccine passport? And so I think we're going to get there. I think, you know, British Columbia is doing something that we'll have lots of similarity with, Nova Scotia as well. And but hopefully in early October we can get that operational. It's a challenge, you know, to say the least. This is a huge undertaking. It's been done in other jurisdictions, of course, and we're learning from that. And we're hoping to have that active as soon as possible, but a lot of detail yet to be worked out.
Okay, so the retail industry, I mean, you could need a vaccine passport to...
Whether or not it goes to, I mean, these are the details we probably shouldn't get into yet because we haven't really totally flushed that out or not. But certainly to, as Dr. Morrison's indicated on a number of occasions, to have large-scale public events, the Confederation Centre and other places, there's a much better chance to have a near capacity crowd or a much larger crowd than we've been having if there's a vaccine passport and testing opted around it. So, yeah. How's that?
Thank you very much.
Thanks very much. You're good?
I'm good.
Okay. Now we can go to some of our friends online for some further questions.
Carrie Campbell, CBC.
Good afternoon. Thank you very much, everyone. I just wonder, I'm thinking maybe the Premier and Dr. Morrison, if you could describe a little more what that you have planned with regards to this vaccinate or test policy, where you might imagine that being implemented, who would be affected by that, how it will be implemented and enforced, when you hope to have that in effect, any of those sorts of things?
Sure. You want to start? Sure. Or do you want me to start?
You can start. We're deciding who's going to answer your question, Carrie. Hi. So I think I want to sort of, for those who might not understand, a vaccinate or test policy, it's already been implemented in long-term care and community care and P.E.I. And so it's certainly encouraging those who are, and the majority of people who work in long-term care and community care, for instance, are fully vaccinated. But those who aren't, or until they're fully vaccinated, are getting tested on a routine and regular basis. And that is a policy that's been put in place in other provinces as well. And so I think the discussion, and I know there's a meeting later this afternoon to go through some of what that policy could look like, but it's not for one, although we focused on long-term care and community care initially, and that I think is certainly, it was important as we saw a fourth wave happening in the country, and knowing that we've had so many outbreaks related to long-term care and community care. That's where it was started, but it really is another way of just trying to protect individuals who may be vulnerable, and it may be teachers, and would be perhaps those who work in correctional facilities, group homes, and certain healthcare workers as well. So those would be the sort of expanding that, and to those who may be working with vulnerable groups who are unable to be vaccinated, or who do not mount the same response potentially to vaccine. So I don't know if
Yeah, look, I wouldn't add much more to it other than to say that as government, we have employees that provide services to islanders, and I don't think it's an unfair expectation for those islanders accessing the service to feel as safe as possible in accessing those services. And it's our hope that the implementation of measures such as this will increase the level of safety and confidence that islanders have in accessing important services provided by their government.
All right, thank you. I just wonder if I could ask how you would deal with this situation if over the course of contact tracing or investigating something like one of these outbreaks in a school, if you came across a staff member who was unvaccinated who might regularly be in contact with unvaccinated students. Now, as I'm asking this, I'm looking at a section of the Freedom of Information and Protection of Privacy Act, which says that the head of a public body shall, without delay, disclose to the public or any affected group of people information about a risk of significant harm. That is regardless of whether any request for the information is made, and it's something that overrules any privacy considerations in the Act. So I just wonder if you could describe how you would deal with that situation if you came across this.
Hi, Carrie. So if, and as part of our investigation into any case, and including the recent cases, if a teacher, for instance, or staff is unvaccinated, then, or even partially vaccinated, they would be identified certainly as a close contact, and they would be in isolation for that period of time of 2 weeks. Those who are fully vaccinated, plus 14 days, would be able to return to work once they have a negative test. So in many ways, that anyone who is a close contact is working with students or anybody in the public would be certainly identified, and isolation is a legal requirement.
I guess I don't understand what you mean by identify. As I look at the act here, it seems to me that this is saying that you would need to, well, it depends how you interpret significant risk, that you might look at this, and this could say that you need to tell the families involved that, the teacher that's in contact with their children on a daily basis unvaccinated. I wonder what your take is on it.
I mean, I think my role is certainly to make sure that those who are not fully vaccinated are isolated, and I mean that's what we have to do for everyone, and they will. And there are consequences for failing to comply with that isolation. So I don't. I think we also certainly take privacy. If they didn't. If they didn't comply, then it's actually reported to enforcement. If they did not isolate, and we're fully identified as a close contact. I may not be answering your question, Carrie, because you may be trying to ask. I mean, if we go to a vaccinate or test policy, and that will be implemented by the different departments, it will really be up to the different departments about how they will be identifying those individuals who are not fully vaccinated. And maybe that's where the question may be better directed, because you're not, because that's a more general, I think you're talking more generally as opposed to when they're just exposed to a COVID case.
Well, yeah, I mean, as I read this again, it seems to me there's a public body here that might have a requirement to disclose the people in this situation. That's just what the situation is, so I'm just trying to get some information there. Maybe the public body would be the public schools branch. It's a difficult question to ask you over the phone, I think.
Yes.
Yeah, look, I would just say, Carrie, I think I understand the premise of what you're saying. I mean, this is a very challenging time that we live in. There's polarizing views on this stuff, and there's been communities and families and that have been divided on this, and there's been information and misinformation. And what we've been trying to do throughout this is we feel our job is to do the best we can to keep as many people safe as we can, and we do that in knowing that some of the measures that we implement don't satisfy everybody, and that's the reality of the job we're in. But overall, we've done a very good job as a province of keeping Islanders safe. We haven't been perfect along the way, and we're really trying to work with the, what I guess a former phrase, with the coalition of the willing, and to get as many people vaccinated as possible, because the vaccines work. And it helps reduce the infection rate across the board, and those who are dealing with Islanders on a day-to-day basis, providing services to those Islanders. We are going to implement a vaccine policy or a testing policy, and each department will operate. They're working now to operationalize how that works. As I said in a briefing this morning with Dr. Morrison, that's a much bigger uptake or opportunity and piece of business for the Department of Education than it would be for corrections, for example. But each department will have to operationalize that and put that policy in place, and it's just designed to keep as many Islanders safe as we possibly can.
All right, and I know I've used up so much time here. If I could, just for one more minute of your time, Mr. P.E.I, I'd just like to get your reaction. The Liberal opposition this morning issued a release calling for, kind of in some form, many of the measures that you've been out this afternoon. But with the vaccine passports, I just wanted you, maybe you could say if this fits the philosophy that you're pursuing with that. What the Liberals called for was something that severely limits the capacity of those who choose to remain unvaccinated to move freely in areas of potential transmission. So that sounds like a fairly restrictive document policy there. I just wonder if that fits in with what you have in mind for how this will work.
I didn't read any of that, Carrie. As you know, I've been saying from the very beginning I don't care much about the partisan politics of this. I take my advice from Dr. Morrison and her public health staff, and we've been working on measures that we're implementing today for a number of days. We haven't made knee-jerk reactions to these for the sake of public outcry or lack thereof. These are based on the best information we have at the time as it pertains to a vaccine passport. As I said, we really want to have events, as many as we can, as safely as we can. Other jurisdictions across the country and across the world have moved in this direction, and that's the direction we will have. But any advice that I take that is implemented into policy, politicians can say what they want, and that's their job, and they should, but I'll take my advice from Dr. Morrison and her staff.
Thank you all for your time.
Thank you, Kerry.
Gabrielle Drummond, Radio Canada.
Good afternoon. Bonjour, Dr. Morrison. Vous avez annoncé justement que vous allez mettre en place cette politique de dépistage, de vaccination dans les écoles, tout comme dans les foyers pour des personnes âgées. Vous avez aussi annoncé le retour du port du masque obligatoire dans des endroits, dans des lieux antérieurs. Et j'aimerais que vous nous expliquiez pourquoi vous prenez cette décision maintenant.
Bonjour, Gabrielle. Alors, je pense qu'il y a plusieurs raisons, vraiment. On a plus de cas de COVID-19, le nombre de cas augmente dans la région, ici Atlantique, mais aussi partout au pays. La quatrième vague vient d'arriver vraiment aux régions atlantiques. Et puis même ici, on a vu le nombre de cas qui augmente assez vite dans les derniers jours. Alors, vraiment, on met ces mesures en place. Et puis, c'est pour... Pas toujours, c'est pour, j'espère, un bout de temps, pas trop long, mais on veut limiter la transmission. Et puis, toutes ces mesures ensemble peut-être, on espère, va aider. Et puis, on a l'évidence que ça aide dans les autres parties du pays.
Et demain, les classes en personne reprennent, sauf à l'école West Variety. Alors, vous avez déjà répondu en anglais, mais j'aimerais l'entendre en français. Quel est le message que vous envoyez justement aux parents qui sont peut-être inquiets d'envoyer leurs enfants demain à l'école?
Alors, première des choses, moi, je comprends cette inquiétude. Je suis aussi maman de deux enfants. Deux de mes 4 enfants ne peuvent pas être vaccinés parce qu'ils sont moins de 12 ans. Alors, je comprends cette inquiétude. Mais je sais que les mesures qui ont déjà en place, qu'on est en train de vacciner beaucoup de monde ici à l'île du Prince-Édouard, on a les masques. En premier, c'était juste dans certaines parties de l'école, mais c'est maintenant à temps plein, de 4e année à 12e année. On a plus de les mesures, on dit en anglais enhancement measures, et puis je sais qu'on a fait beaucoup de tests, 3500 tests depuis quelques jours. Je pense qu'il n'y en a pas grande transmission qui est en train d'être à l'école. Mais je vais aussi être certain que mes propres enfants ne sont pas malades avant d'aller à l'école. Et puis, c'est vraiment important pour tout le monde de pas aller à l'école ou aux autres activités s'ils sont en train de se sentir mauvais.
Et je me permets de vous poser une toute dernière question. À la lumière de tout ce qui s'était passé dans les écoles cette semaine, est-ce que vous pensez que vous auriez proposé, si vous l'auriez su, est-ce que vous auriez proposé un plan pour la rentrée scolaire plus sévère? Je voulais savoir, est-ce que vous auriez fait d'une autre façon ce plan pour la rentrée scolaire, vu tout ce qui s'était passé cette semaine?
Vraiment, Gabrielle, Non, j'aurais pas changé grand-chose parce que on savait qu'il y avait une chance qu'on aurait les cas de COVID-19 dans les écoles. Et c'est pour cette raison qu'on a mis les mesures en place qui sont là avec les masques dans une mesure dans les places ou en transition vraiment aux écoles. Mais c'était un cas où si on a l'évidence, on veut mettre les mesures un peu plus augmentées. Et puis, on a fait ça et on a comme je pense qu'on a fait avant, si on voit quelque chose, vraiment on participe assez vite, on voit les choses qui changent et puis on annonce des changements. Et puis peut-être on doit faire encore, mais j'espère qu'on va minimiser le nombre de fois qu'on va faire les changements comme ça. Mais non, je ne changerai pas les plans qu'on a annoncés.
Excellent. Merci beaucoup.
Merci.
Bonne journée.
Bonne journée.
I think that's the end of our online calls. Do either of you have anything more you need in here since you're here?
I just want
Oh,
to verify
sure.
the total case number, just if any had recovered or not.
The active cases is 27.
Okay. And since you asked, I'm wondering also, Dr. Morrison, is there any indication of how it was spread at all? Any factors involved there with the spread of the West Royalty cases?
Well, I mean, I think in terms of the outbreak at West Royalty, the cases seem to be with close contacts, and many of the additional cases have been related to close contacts, and I mean that's how we know it's spread.
Thank you.
Thank you, everyone. Appreciate it. Thank you, Dr. Morrison and Norbert, and stay safe, all Islanders. Thank you very much.